I think then last minute, I think 30 seconds each from Rajiv, then Neeraj, then I'll, and then I think Dr. Gajanan will say the final few words to close the show. Dr. Rajiv?
Sure. Yeah. So again, dear friends, it was very good academic session on functional dyspepsia, how to diagnose and how to treat. I still believe that the efficacy of many drugs, apart from ecosamine, etopride, is not there. We have to make our diagnosis correctly, and we have to use these drugs very judiciously. And once patient is not responding, we have to revisit a diagnosis rather than giving these medicines for indefinite period. And still we are waiting. The functional dyspepsia, still it is a mystery, just like IBS. As the diagnosis will become more clear, what is the pathophysiology, more and more drugs will come. But as for now, two prokinetics, etopride and ecosamide, they have a very good role and should be used in the patients who needs them most. That will help us, and timely stopping rules should be applied to these drugs. Yes, that's all from my side, sir.
Neeraj?
So, from my end, so main important thing is that you rule out organic causes of dyspepsia. So that is very important. First, while taking a history, look for any red flag signs. So whenever if you feel there is any red flag sign, so you should directly refer these patients for an endoscopy. So otherwise, definitely there is role of empirical PPI therapy, but we should always consider H. pylori in our diagnosis because we are in a high prevalence state. So there are multiple ways which we can test if your patient is willing for endoscopy. So that is the best way. More affirmative diagnosis, not willing, still there are methods which you can diagnose so that we can treat this disease.
So I think wonderful. So I'll say two speakers, both had a very lucid presentations, made this topic even more interesting, and what they could clarify to the audience. So it's a clinical thing. So you need to spend time with the patient. We need to subcategorize. Whenever in doubt, we should investigate. And once we are clear with the diagnosis, the appropriate line of treatment should be instituted from the very beginning. So I would say a lot of misconceptions cleared, lot of myths dispelled. So real thankful to both Neeraj and Rajiv for making all of us and the whole audience much wiser with today's presentation. Thank you, colleagues.
Thank you.
Thank you, sir.
Thank you.
Gajanan, ball is in your court.
So as we have come to end of this insightful session, I take a moment to thank everyone for making this CME a success. First of all, I would like to thank our chairperson, Dr. Nirmal Singh Malli, and our speakers, Dr. Neeraj Singla and Dr. Rajiv Goel, for sharing the expertise and insights. Your presentation and discussions enrich our understanding of the topic functional dyspepsia, focusing on postprandial distress syndrome and the use of prokinetics, especially ecosamide in this scenario. Also, I thank our audience for their active participation and engagement and posting their queries, which has made this CME an enriching experience. I hope the presentation will have a lasting impact on your clinical practice. So thanks once again, everyone. We hope to reconvene soon, continuing our pursuit of scientific excellence and advancement. Good night, everyone. Bye.
Thank you, Dr. Gajanan. Okay, sir.
Okay, bye Rajiv.
Bye, sir.
Bye Neeraj. Bye
Thank you, sir.
Gajanan, the whole
Thank you
team.
so much, sir. So
Lupin
from here, I'm
Pharmaceuticals.
ending this meeting.